MEC gave a variety of reasons: human resources, shortage of ICU and high care beds, equipment and consumable factors, and also patient factors. Sometimes the patients don't eat, they've eaten and you're supposed to fast before an operation, or they don't pitch up, or some of them died before the operation. According to the MEC, only 1.3% of all these operations were due to avoidable factors, but I don't think that can be true at all, because I think if you're not able to operate because you don't have an ICU bed, well, then build extra ICU beds. And I get constant stories all the time of operations cancelled because of shortage of clean linen, or the air conditioning isn't working, or they're short of staff. So I think that a lot of these cancelled operations are avoidable, and it's just very tragic to have so many, thousands. It just adds to the very long waiting list for surgery at this particular hospital and at other hospitals as well. It's a big problem.
Also, these are operations for procedures, for avoidable complications. In other words, if you don't have an operation that you're supposed to have, you may end up in an emergency room or having it in an emergency procedure a few months later.
Well, look, they always give priority to emergency cases, and some of these elective procedures are cancelled because they are giving priority to an emergency case. But I think that there's clearly a lack of capacity and poor management at the Charlotte Maxeke Johannesburg Hospital. This is our leading hospital. So if it's as bad at this hospital, it's probably worse at other hospitals. And the overall backlog for surgery in Gauteng is over 36,000 rand. It's over 36,000 people. That's an enormous amount of suffering. You can wait 5 years for a hip op in one of our hospitals. Now imagine you've waited your 5 years, then you don't eat because you're in preparation for the operation, and then the operation is cancelled. So just think of the human tragedy behind this.